Good morning, good afternoon, and good evening. Thank you for making time to join us in tonight's AeHIN Hour webinar. During the session, you may leave your questions in the chat box. They will be answered during the Q&A session at the end of the presentation. Microphones and webcams of attendees are temporarily disabled during the presentation, but will be enabled during the Q&A. If you're having technical difficulties, you may chat with the AeHIN Secretariat and we will try to assist you as much as possible. This webinar is being recorded. Materials from this session will be shared via email. Tonight's webinar will bring about a broad spectrum of perspectives on what the health data governance principles mean to various roles in the digital health ecosystem for a care recipient or care facilitator, caregiver, digital health focal point at the Ministry of Health, hospital CIO, National Health Information Standards Agency, public health researcher, and donor and development partners. To facilitate tonight's webinar, I would like to introduce our moderator, Mr. Jai Ganesh Udayasankaran, Governing Committee of the Asia eHealth Information Network. Sir Jai is a member of the Expert Committee at the Global South Health Observatory of the Fondation Pierre Fabre in France. He is an advisory committee and board member of the Global Digital Health Network, part of the Digital Health roster of experts of the WHO, a visiting faculty at the Department of Health Information Management, Manipal College of Health Professions, Manipal Academy of Higher Education in India, and a member of the Health Informatics Sectional Committee of the Bureau of Indian Standards. Without further ado, I would like to pass on the virtual floor to Sir Jai to introduce our speaker and reactors.
Thank you, Chia. We'll move over to the speaker now. Our speaker this evening is Kirsten, and she's the lead for policy at Transform Health Coalition. And then we have several reactors, Dr. Bunchai, who's the chair of AeHIN, and Dr. Alvin Masalo, who's the executive director of AeHIN. And then we also have Fazila from the Ministry of Health, Malaysia. And then we have Anis from Indonesia, who's also a researcher and lead for Health Data Association in Indonesia. And then we have Ms. Tomoko Fukuda from International Planned Parenthood Federation. And then also we have Dr. Leo from MIT. And then we have Mr. Nirmal Dakal, who is from GIC, the German Development Agency, working in Nepal. I will now hand over the floor to Kristen for a quick overview on the health data governance principles. And then after that, we will have an interactive conversation with the reactors. Thank you. Over to you, Kristen.
Thank you, Jai. Great. So thank you again for inviting me to speak during the AeHIN hour, speak about the health data governance principles and more generally the need for stronger governance of health data. So as we know, with the increased digitalization of health systems, it's led to a huge increase in the amount of health data that's collected and used every day. And while this has a huge potential to improve decision-making and health outcomes, we also realize it sparked the need for stronger and more equitable governance of that health data to ensure it's really supporting public good. So while there are a number of countries and regions around the world that are instituting good health data governance policies and legislation, we realize that there's not yet a comprehensive set of principles or a global framework to really guide the governance of health data across public health systems and policies. Though at the same time, there is huge growing recognition of the need for that sort of global framework or global guidance. So for example, for those that were part of or said outcome statement of WHO's Health Data Governance Summit last year, it recognized an outcome statement and called for a common framework for good data governance practices underpinned by globally unifying set of principles. Also, the recent Lancet FT Commission Governing Health Futures report included a recommendation that called for new approaches to the collection and use of health data that prioritizes and protects human individual rights and promotes public potential of such data. Realize that a global alignment around a core set of principles and a global framework could really promote a common understanding of what good health data governance should accomplish. And it would support more equitable and responsible health data management while safeguarding data privacy, ownership, and security. So Transform Health, we're a coalition of organizations committed to achieving universal health coverage by harnessing the potential of digital health and data. Working together with our coalition partners, we've been trying to help fill this gap by stewarding the development of a set of equity, and human rights-based health data governance principles. Furthermore, we're also calling for a global health data governance framework, which is underpinned by the principles, and for this to be adopted by governments. So we've been working with our partners and very much under the guidance of our policy circle to facilitate an inclusive and consultative bottom-up process to develop the health data governance principles. And this process has been largely driven by civil society. The process was very intentional to very much gather the perspectives and expertise, and importantly, to ensure the meaningful engagement of diverse stakeholders from across geographies and sectors. So in this process, we had 8 global and regional workshops, including across all the regions, and AeHIN was very much instrumental in the Asia consultation. We had global consultations as well, including a youth-specific consultation to really bring in youth's views and perspectives into this in the development of the principles. And once we had a draft set of principles, we then had a public consultation that was open for a month to gather further views to really strengthen them. And this has led to over 200 contributors to the development of the principles across governments, international organizations, regional and national organizations, civil society, private sector, youth, among others. And that's led to the set of 8 principles, which we're presenting today, which were launched in April on World Health Day, so on the 7th of April. And the principles very much recognize and build on existing norms and principles and guidelines, but we see them as really furthering and strengthening the health data governance ecosystem. But what's distinct about these principles is, as I already talked about, the process through which they were developed. So very much a very inclusive participatory process, as well as their applicability and their framing and content. So as I mentioned, developed through a very inclusive process, but they're also applicable to a wide range of stakeholders as well, whether governments, technology companies, donors, and other stakeholders that collect and use data, and we'll hear from some of those stakeholders themselves later during this session, and also can be used by organizations to advocate for stronger health data governance. And then in terms of their framing, which really kind of the unique value and how they strengthen the health data governance ecosystem is they bring a strong human rights and equity lens to the use of data within and across health systems. Well, they include core principles around protecting people and creating public health value. They also go beyond this and are more forward-looking around equitably distributing health benefits towards universal health coverage. So UHC, universal health coverage, is very much at the core of the principles and in their design, which need to be central to the governance of health data. And they're oriented towards supporting sustainable and resilient public health systems. They very much aim to align policymakers and other stakeholders around a shared vision of equitable health data governance, where all people and communities can share and benefit from health data. They very much aim to bring that global alignment, but then to strengthen national and regional health data governance approaches to really maximize public health value while protecting individual rights. And as I mentioned before, we very much see them as a key and very critical step towards the development of a global health data governance framework to further strengthen that. So the 8 principles, which hopefully you have all had a chance to see, and I do encourage you to go visit the website to look at them in more depth. You can see them presented on their screen. So there are 8 principles, and they're clustered around 3 interconnected objectives. So they balance both individual and collective perspectives across each of these 3 objectives, encouraging a solidarity-based approach to maximize the value of health data for whole populations. So the first set of principles is clustered around protecting people, which that considers the importance of individual, group, and community data protection. The second group of principles is clustered around promoting health value. So through data sharing and innovative uses of data, and it really speaks to the collective needs and benefits of public health systems. And then the third cluster of principles on prioritizing equity looks at really ensuring equitable distribution and benefits that arise from the use of data in health systems. And so that's equity among groups and individuals. And just to make a point here of just saying that the 8 principles, they very much complement and reinforce one another. So they're not listed in any particular order, they're not weighted in any way, but they're very much seen together and they all complement each other to help strengthen health data governance. And each principle, when you look more in depth, which I won't go into today, but I do encourage you to look at this on the website, each principle is supported by a core set of elements, which then describes how it can be put into practice. That's just a quick overview of the principles. So as I said, they were launched on World Health Day on the 7th of April, and they've already been endorsed by over 80 organizations. And this covers global, regional, national organizations, and various stakeholder groups as well. So they're endorsers from academia, research institutes, international and national NGOs, foundations, private sector, regional networks, including AeHIN, and national institutes and professional associations. And we really want to see governments now endorsing the principles. So we really encourage everyone on this call to endorse through your organization the principles, and to also really call on your governments to endorse them as well. And just to say, so we very much see Wealth Transform Health with our policy circle. We've stewarded the development of the principles, but we very much want them to be community owned. Therefore, they're hosted on their own website. It's available in 3 languages, including all of the resources. You'll see on the website an overview of the principles, logos of endorsing organizations, as well as a number of resources to really support their use by different stakeholder groups. So there's a user guide, which gives some kind of tips on how different stakeholder groups can apply the principles, as well as an advocacy and communications toolkit to support those advocating and communicating about this agenda, frequently asked questions, as well as a number of other resources. And just one more to highlight on the website, that we have a community page, because as I said, we really want them to be community owned and used by different stakeholders. So this is a page dedicated to really amplifying those efforts. So it will feature articles, events. It already has a few case studies to show the social media discussions, etc. And we really encourage stakeholders, including all of you, to contribute to that page by sharing any case studies of how the principles can be applied, any articles about them, any events you're organizing, tweet about them, and just to really join the discussion to amplify this important topic, advance this agenda. So if I can just, before I wrap up, just kind of where we now kind of see how we want to push forward on this agenda. So as I said, we really see the principles as being a key milestone towards the development of a global health data governance framework with the principles at their core. So a framework very much driven and underpinned by equity, human rights, and UHC. But we'll see them as a tool to advocate for this. So essentially, we're calling for a global health data governance framework to be developed and adopted by governments. To ensure this happens, we ideally need governments to mandate the WHO to develop such a framework and to support and adopt a World Health Assembly resolution on it. But it's very important as well that such a framework is developed through an inclusive multi-stakeholder process similar to the principles. And then ultimately, once adopted, we will need to see a global framework then adapted and domesticated at regional and national levels to really drive stronger health data governance in countries. So in order to kind of advance this agenda, we're really encouraging governments, regional bodies, private sector organizations, and all of you to help take action to strengthen the governance of health data. So first and foremost, please endorse the principles, and we welcome those that have already endorsed them, and to take action around the upcoming World Health Assembly taking place later this month to really champion the need for a global framework and a WHA resolution on it. And for those that will be in Geneva, please do reach out, because we'll be organizing a side event on health data governance, and there will also be an option to join the live stream. So we'll be happy to share those details as well. And also to prioritize health data governance as part of other global, regional, and national agendas, for example, at UN General Assembly, as part of G20 discussions, and importantly, as part of other regional and national discussions and events. And to really advocate and hold governments and stakeholders accountable to delivering on this, and importantly, to really meaningfully engage communities, particularly the most marginalized, in discussions and decision-making around health data governance. So we just really encourage all partners to support and champion this agenda to really maximize the public health value of data while protecting human rights. So I'll end there. Thank you very much. You can see the website of the principles there. I do encourage you to go on, check it out, and amplify and help share as well. Thank you.
Thanks, Christine, for that digest on the whole set of principles. And then now we will have our expert panel sharing their perspectives. And then we have 6 reactors today. And then maybe we will start with the perspective of care recipient or care facilitators. So Tomoko, I will go over to you first. So Tomoko is the regional director for International Planned Parenthood Federation in East and Southeast Asian and Oceania region. So Tomoko, like, what do you think in your work? How do you think you can take these principles to practice? And then do you see any gaps that could possibly be addressed? Because this is of course, this has been evolved, as Kristen mentioned, it has evolved over a lot of time with a wide spectrum of contributors over a lot of time and effort, but still that it has to be in alignment with what is evolving, and then it's also a living document. So please do feel free to even share any of those feedback that you think those, if there are any gaps, and then also please tell us, like, how do you think that in your work these principles can be put to practice, especially with respect to, like, I would request you to represent those care recipients, the patients, and then those facilitators for whom the care is given. Thank you. Over to you.
Thank you, Jai, and thank you, Kirsten, for that really comprehensive introduction of the health policy. And first, I'd like to say that this is very much welcomed. I think it's probably long overdue that we have really strong, good health data governance principles and frameworks that we can all align to, because it is a critical part of our healthcare services, but perhaps an area that have been overlooked. And as IPPF, we work with national organizations across 140 countries, and we really, so I can talk on behalf of the recipients and the frontline service care providers. We are not the big hospitals, we are more the health clinics on the ground and in the communities. And health data governance is something that, to be very honest, we also struggle with. So I think we can definitely put to use the principles and making sure that we ourselves are aligned as we serve the community people. And on behalf of the community people, I really appreciate the 3 areas and the 8 principles that have been brought through from this extensive process that you had, and the special focus that you have on people, especially because we do have to cater to all the diverse needs and situations of every individual. And the more we are getting in the market, we are also more individualized, and we need to know, and data needs to be disaggregated and more specified to specific groups of people. And that means that it has to come with privacy. It has to come with all of the data management, confidentiality that you have there in the principles. And it is extremely, extremely key in gaining health confidence from the clients. And it's a challenge. Just want to say that you do need technology there, but you also need the awareness there. So you need the awareness of confidentiality to make the technology work and for it to be useful on the ground. So you need both of that. And also, I just wanted to mention appreciating also promoting the values and promoting equity is also very much appreciated. And I thought in the next steps, and as we go forward and you make the frameworks and then you have countries endorse, words like promote is very easy to sign up to, but it's also very easy to say, yes, I'm promoting, but not be held accountable. I would like to see in the future, perhaps more stronger kind of push to government, for example, and also organizations to say, no, we will not use data to discriminate or marginalize, much stronger kind of thing that we have to sign up to ensure that we are not making use of data in that way. And then finally, just to mention, in terms of, you also having your principles about the sharing, I've been a member of the civil society engagement mechanism for universal health coverage. And when I was an advisor there, one of the key things that we did continue to advocate for was to have data shared back to the civil society. And we do say it often, and we do ask for it, but it's also an area that it is hard to realize. Not often, oftentimes data is not shared completely. Transparency is very key. Being held accountable is very key. So not just sharing the information that you want to share, but it means sharing all of the information and being transparent about the information. I think that needs to be there, and it's a very critical issue. But welcoming this initiative, and thank you very much for giving me the opportunity to share back some of my thoughts. Thank you.
Thank you, Tomoko, for the crisp intervention. And then you just kept it at 4 minutes. So that what was also expected, like request all other reactors also to keep it within 4 to 5 minutes. And then this was very important, like what you shared, like also giving back to the civil society or giving the feedback to them. I think that's also very important. I will move over to Dr. Leo now to give the caregiver perspective. Like he's also a critical care physician, and then also he's also he works with critical care data at MIT, and then means he is very passionate about having data sets being created in Asia and then used. Like so, over to you, Leo, to give that caregiver perspective as well as someone who actually literally works with the data. So you have the experience of what data could, like how a good quality data, and then how it could give meaningful results. Like, you are an user also. So please do share with us your perspective. Thank you.
Sure. Good evening, good morning, good afternoon to everyone. Thanks, Jai. Thanks to our friends at AeHIN for organizing this online event today. And I just wanted to give a brief overview of the projects that we have been involved with, which is creating de-identified electronic health record data and making that available to the research community. This project started in 2002, and our data sets have been in maximal use, I would say, for the last decade now. And what I wanted to emphasize is that when we started, we did not have principles of data governance established. We knew that the principles will evolve over time. We abided by our commitment to open data science and our belief that health data is a public good. As long as there is transparency, as has been emphasized by the two previous speakers, as regards which data are being collected, how they are being collected, who are accessing the data, and most importantly, for what purpose, it should not deter us from just diving in there and start creating those data sets. At the center of the MIMIC project is our objective to engender an inclusive, multidisciplinary, collaborative research ecosystem. I support the need to establish sound and ethical health data governance principles, but these principles are empty unless we start applying them to the creation of data sets. I often hear comments that health data in low and middle income countries are not ready to be shared and analyzed, and I will strongly push back against those comments. We cannot wait until health data quality is perfect. Based on our experience, I could guarantee that the quality of the data will improve as we engage the community of users, including the patients who will benefit from the analysis of the data. So what I'm hoping to see is that as soon as we have the governance principles in place, that we should not waste time, because I think the longer we wait and the longer those data are sitting idle in servers, then we are not doing a service to the patients who we care for. And let's use these principles in action. Let's start creating those data sets.
Thank you, Leo. Now we will have Alvin Marcelo, who is also the executive director of AeHIN, and then also he is a trauma and general surgeon, and he's also a chief medical informatics officer in a private hospital in Manila. So Alvin, over to you. Like, how do you think that these principles could be put to use in your work setting as a CMIO? And then in general, like, do you see any gaps that could be addressed? Any feedback from you will be very valuable. Thank you.
Thank you, Jai, Kristen, and Tomoko for your comments. Leo as well. I concur with Leo. The principles will not really be alive until we apply them in the work that we do. I think I really like the principles. I'm a researcher, so I abide by the ethical principles of research, but I really find the health data governance principles more specific and detailed. They give more form to the abstract principles of autonomy, justice, non-maleficence, and beneficence. Those are very high-level concepts that we embrace. But when it comes to health data, what does beneficence mean? When it comes to health data, what does non-maleficence mean? So I think we really hit the nail on the head here. We came up with a very clear set of governance principles for health data. And I think we will fly from now on because there is clarity now on what we mean by ethical health data processing. I appreciate the process. I was a participant in the early regional consultations. And then I know that the regional inputs came on and they became global. And then now we're here. We're talking about the global health data governance principles. I think the bottom-up approach is very important. Even if we knew the principles last year, but if we didn't go through the process, I don't think it will have the same impact to the participants as much as they have right now. So process, putting people first, I think is really the most wonderful principle that I really like about the health data governance principles, because all of these autonomy and justice, beneficence and non-maleficence are really about people, that you want to protect the people. So I think in 2 words, no, the principles were able to capture that very important concept of putting people first. The principles, I think, enables data stewards right now to start innovating, and they can innovate within the boundaries of good ethical practice as defined by the governance principles. I think it's very important because, as Leo said, there are a lot of data already in low to medium income countries, but they're not really courageous enough or confident enough to release the data. We keep saying our data is not good enough, but as Leo said, you'll never know until other people actually can see the data and have use of it. We're all afraid to release the identity of our citizens, but in fact, do we actually know how to manage the data and how to release the data securely? So there are a lot of questions that the governance principles answer, and I think the next year or 2 would be about propagating the principles and getting more people to comment about how they can apply the principles to the data sets that they manage and curate. I think we should conduct more workshops. We should promote this. For myself, I would embed this into the courses that I teach in undergraduate medical school and in postgraduate medical informatics courses. They will be one of the first topics that we'll be talking about, because the rest of the courses are all about health data management. So if they don't have the principles clear at the outset, they will not know what are the allowed, what are the boundaries within which they're capable of innovating. I would invite our Ministry of Health to co-host a webinar just to talk about the principles. I'm not going to ask them to sign off on it, but I'm going to ask them to co-organize together with the Philippine Society for Digital Health, which I am part of, and just get the pulse of the people, the students, the health professionals, or even the public, just for them to just know and give a signal to the citizenship that we are aware of the principles and we'd like to know what your thoughts are about it. And I hope that when the Ministry of Health participates and co-organizes that event, they would be more ready to embrace it, rather than just asking them to embrace it just overnight. I think it also has to go through a process within the country that we would get grassroots organized around understanding what all of these principles are all about. I think regulatory sandboxes will be the in thing in the near future. Government-sponsored safe environments where different stakeholders can start experimenting with their software, finding how the software can help government with their health data problems. We can apply the principles within those regulatory sandboxes. And lastly, I think we can help monitor the adoption of these principles in the Philippines. We have a network of medical students and nursing students who are already embracing digital health. So might as well make sure that they know the principles so that they can embed it within their own local conferences. So that's it for me. Thank you.
Thanks, Alvin. And then I think your offer to work with the Department of Health in Philippines and also the Philippine Society for Digital Health in organizing a workshop and having this discussion will be very valuable. And then thanks for raising about the regulatory sandboxes. I think many countries in the region are working. For example, India, Singapore, Malaysia, Indonesia are already working on regulatory sandboxes. So this is a very, very good. Maybe maybe in another forum we could discuss this in detail, but it's a very, very valuable perspective. Thanks, Alvin. Now we will move over to Anis Fuad. And Anis is a researcher in Center of Health Policy and Management at Gajah Mada University in Indonesia. And he's also the lead for health technology for Indonesian Hospital Association. Anis, how do you think, what is your perspective on the principles, and then how do you think this could be put to practice from the hospital's point of view? And then also, of course, like you are a researcher, so please do share what do you think could be done. Thank you. Over to you.
Yes, thank you, Jai. Can you hear me?
Yes, loud and clear, Anis.
Okay, yeah. First of all, I'm very happy to be invited in this forum. And thank you, Kristen, for sharing the health data governance principles that I think it is very important for us for, I think, not as big as India, but we are the fourth most populous country in the world, a country with many data around us, with more than 270 million people, and our universal health coverage administrator currently manage about 220 million members. It's a huge data, big data. So the principle is very important, not only for us as a country, but as we learn that this principle also aiming to support universal health coverage, it's also important for our UHC operator. So I also agree with Dr. Alvin Marcelo that we need to follow up the principle in the global level and then discuss in the national forum. So we need to invite, for example, our UHC operator to discuss how this principle to be adapted on managing the data that currently managed in our country. So I just remember one of the statement from Professor Enrico Cuira, among the guru in health informatics. He said that data is not like many others say, oil. Actually, it's more than oil. It's about people. So we need to handle with care. So the principle is very important because if we don't handle the data properly, we bring some negative impact to our population. So the ethical principle is very important to ensure that data will be collected responsibly and also usable and later on will be valuable to the people. So in this context, I think for Indonesia, when many healthcare providers, as I'm also involved in the Indonesian Hospital Association, many hospital, many healthcare provider are required to collect data. But if the data and then collected into in the national level, but it is not easy to be used to find, so it is not ethics. So it is not using the principle on collecting the data. So what I also consider that it is important as well, when the data collected, it should also be findable, accessible, interoperable, and also reusable. So we need to use also the principle of FAIR, the findable, accessible, interoperable, and reusable, so that the data will be useful for the people. And I think in the perspective of the FAIR aspect, this principle will also be important, not only for the people, the individual, but also the organization. In Indonesia, with many universities and also many research institutes are working with the data. So the principle should be discussed. And also, I agree with Dr. Alvin Marcelo that a more interaction in the field level on how to access the data, how to use the data will be useful to improve and also to strengthen on how to apply the principles in the ground level. So when we finally improve the principles and also bring more open society to discuss about data, so we could support and build the trust of the community to the data. The COVID-19 situation in Indonesia, we saw that the people are also not very well accept with the way that the government collecting many data, but then do not in the same way build the trust to the data that collected by the government. So in this context, I think the principle is very important, and we need to support and strengthen the principles to improve our society. Thank you, Jay.
Thank you, Anis. I think I really like your point of handling the healthcare data with care. Like, it's fragile usually. So I really like that point. And then let's move over to Dr. Bunchai, who represents the National Health Information Standards Agency. So let's see what he has got to say. Over to you, Dr. Bunchai.
Thank you. First, I would like to congratulate Transform Health that you can kind of collaborate people, developing partner and country all over the globe to come up with this kind of the principle. I think this is the time, like Tomoko said, that we should have this kind of the principle for a long time. And like Alvin said, it clear to everyone more how about the more abstract. And what I like is that we are behind the bigger principle like the human right and the USC. That is a bigger principle that puts on the health data governance principle. I learned it. I read it several times, and I think it's quite comprehensive. The three objective is interconnected, and it's really answers several questions. One question is that it answers the meaningful use of the data, which is for the individual, for the public health, and also for the healthcare provider and manager. But it also address the privacy, confidentialities, and also the equity of the both healthcare and data. Otherwise, we will going to have more digital divide if we implemented those different. This principle also address all of those. I think that is in terms of the comprehensive. I don't have anything to add in terms of the principle. But I think the weakness of this kind of the statement or principle is that there is no guideline, like Leo said. We should have to have a come down to the practice, how we can put those principles into the practice. Maybe the use case, maybe in the next 5 years, we will come up with that address all these 8 principles. And to me, I think those is the gap that we have to put on. Another weakness of the principle is that the website. I think the website with the light behind is not attractive. It's more on distract. So that I think it's very distract when you trying to learn about this. That is the limitation or the weakness of this. So I encourage that we doing this in a civil society, in among the grassroots and civil society. I have questions. I don't know who are going to ask. How when we presented this to the representative in the WHO, how they respond? Because recently I joined the one of the workshop, and then one panelist raised that, do we need the global framework of digital health governance, something like that, which is what we do now. But I think that those framework is essential and it's very important, especially when we have a bigger principle like human rights and the USC. For sure, human rights is a problem all across the country. We will face those when we implemented the digital health data governance. I think that is my perspective on this, and I realize because I work on the interoperability and health data standard, which is very important for data sharing and quality of data. If we don't have this in the principle, there will be very unfortunate, and it will not be very complete of this kind of the principle. Thank you.
Thank you, Dr. Bunchai, for the important linkage to UHC as well as the human rights lens. I think that's very important. And then I do hope you have been associated with the Thai Health Information Standards Institute, and then having this as probably as a guideline to develop standards, I think will be very valuable. Now we will move over to Dr. Fazila from the Ministry of Health, Malaysia. And Dr. Fazila has been involved with digital health for a long time, and then she's also the lead for the electronic health records and the lifetime health record in the Ministry of Health initiative. So Fazila, how do you think Ministry of Health could probably put these principles into practice, and then do you have any feedback for any improvements? Over to you, Fazila.
Thanks, Jai. We have heard many times, in fact, Anis also has mentioned that data is the oil of the future. But I think like oil, it's only useful when it's cleaned, refined, and it is managed well. So I think more and more importantly, data governance is very important today. But in Malaysia, we have some data governance framework, but it is very project specific. For example, our Malaysian Health Data Warehouse project. So when we did that, we set a governance structure and also how we manage the data. It has been very specific. So I think that having a universal data governance is important. And what that we saw today, what is published is something that we can adopt and also adapt to local needs. And I like to congratulate Transform Health because I think this is a very comprehensive document. It covers all aspects of individual, community, society at large. It is very universal principles, and every country can adopt it. And you have input from many experts, including public consultation. That is very important because for public, it's very important how the data is managed. And I think with all the experts' input, it's like a global benchmark. But interestingly, I think the youth consultation is something interesting, I thought, because, youth being digital nomads nowadays, they will definitely bring a whole new perspective of data. I congratulate Transform Health for having a youth consultation. But as a nation, as we're moving towards digital economy, digital society, digital community, digital trust is important. And I think big part of the trust is data governance and data stewardship. But I will also like to make a comment on what Leo mentioned. You know, we don't have to wait for data to be of quality before you share it. I think all of us have a lot of data and we can share. And in Malaysia, we are now moving towards a big data ecosystem. We are talking about open data. So I think this is a perfect timing to have a very universal principles for us to adopt. And also, like how Alvin mentioned, he will he will collaborate with the local team. I have my health data warehouse team in this call tonight. So perhaps with them, we will also try to see how we can advocate these principles at our local level, and if we can adopt it and also adapt it. But I have one question. I'm not sure why we have to wait for 2024 for a World Health Assembly resolution. I think that's too late. Today, after 2 years of pandemic, data is so important. So data governance, data stewardship, I think should be one of the main agenda in World Health Assembly. And once WHO has a resolution, every member country will adopt it. So I think waiting for 2024 is just too long. So I hope that can be the Gantt chart or the timeline can be shortened, within the next 1 or 2 years. So with that, again, I would like to congratulate Transform Health, and I think we will adopt it, and we will see how we can use that in our own use at Ministry of Health and also for the country. Thank you.
Thank you, Dr. Fazila. I'm sure that with support from Ministry of Health like you, I think we can achieve a lot. I think that's very important for people like you to endorse and show us the way to put the principles to practice. I think I'm sure that many other countries will follow the lead that you and your team will be willing to help. Now we will move over to Nirmal Dakal from GIC Nepal. I just try to follow some pattern, starting with care recipient, then a caregiver, then a hospital, the public researcher, and then a standards agency, health information standards agency in a country, and then the Ministry of Health, and then now over to Nirmal for the development partner, because you work with the whole spectrum of stakeholders to make things happen on the ground. And you have tremendous experience in implementation of HIS in the LMICs. And then what do you think, Nirmal, what do you think about the principles and how do you think these principles could be put to practice? And then any feedback from you would be very valuable. Over to you, Nirmal. Thank you.
Yeah, thank you, Jai, and thank you, AeHIN, for this opportunity. And thanks, Christine, for the overview on health data governance. So when I see the document and website, I can see that the 8 principles are well defined, and also you have defined the core elements, so which is also a guide for us to implement the health data governance. And I can also see that the focus is on people, so that is very important for this. Implementing the health data governance principle. So I'll share you briefly how we start our project or support the government. Initially, we discussed with the Ministry of Finance and also our partner Ministry of Health and do the negotiation, and the government request a certain area that GIZ can support. So this is how we start our program. So that means our program and support is in line with the policy, strategy, and also periodic plan of the government. So it is directly linked, and the support is directly linked to these factors. So based on that, it is important that the government also endorses the health data governance principle. So for this, your organization can also do, like Alvin has also earlier said, that some program workshop is very important to do the promotion. And also, I think in this case, AeHIN also is very active in our region. So like this sharing meeting, AeHIN can also conduct many workshops and promote the use of health data governance. And like Dr. Fazila said, hope our government will also endorse very smoothly. So the promotion and advocacy is very important. And for us, so I can see that government for digital health intervention, digital health solution, they look up to the development partners to support, because it involves initial investment and also research innovation. So they look to us. So for us also, it is important to understand the health data principle and also apply it. And also we are part of the government, so through different technical working group, we are directly working with the government. So the organizations like us should also have the better understanding of health data principle. And while implementing, so we have been following some of the principles, but not as an overall package. Individually, we are doing this. Data security, also implementing the health information system, and also promoting the equitable benefit from health data that we are doing. So, and also when it comes to digitalization or data governance, I can see that more focus is on health information system. And recently, or in very recent time, so our focus has moved on to digital health interoperability and also data security. So these are new things. And if we have the health data governance principles like this, and we can follow this, and beforehand we have this, then it will be very better to implement. And yeah, so we have these are the things that I wanted to share. Thank you.
Thank you, Nirmal. And these are very valuable. And then, like, if you need any help in terms of organizing maybe a workshop in Nepal together with GIC and AeHIN and Transform Health, I think we'll be glad to help you with that. Thank you very much. And then I do see some of our partners, peer networks from Latin America. I can see Jocelyn and Maria here. Maybe I'll just call upon quickly. They are our peer networks as well as partners. Maybe a couple of minutes to you, Jocelyn and Maria. Maybe share your experiences in your regions, and then, of course, like you have been involved in the data policy circle as well in drafting these principles.
Hola, hello. How are you doing today? First of all, receive our congratulations for this amazing and incredible webinar. It was very nice to hear you all from the perspective of your region. We from Recalinsa belong to Latin America region and Central and Caribbean region. And it's nice to know how people anthropologically live the same status. That means that we have the same problems, and that is happiness or good news in a way, because these principles are basically, when we work with, with ethics, I'm a bioethicist and I work in public policies, and public policies for research, from research to market access and from research to attendance. First of all, I want to explain that from research to attendance, that means from research to assistance, these principles are crucial for the understanding. It shows that they have had previous deeply work from the philosophical perspective too. And this make this material so good for an ethically grounded justification of their incorporation. In Latin America, for instance, I have written this through the chat, and we are using these principles. And it's amazing because I've never seen, as an ethicist, bundle of principles like this one. Alvin Marcelo said something that from when we speak about beneficence, justice, autonomy included, but not maleficence as the minimum condition, these principles gather all. And for research from academia where I belong, these principles are a bundle of highly valuable material to be incorporated in the operative manuals for research. And this is not a non-important issue, because from the academia and from the research ethics committees, we make a lot of guidance with supported decisions, and it's not a non-available opinion. It's a crucial opinion. So this bundle of principles are of great support for research, and research make or need or is a crucial actor to show the legacy of what is being incorporated as a good. So when we speak about social good or health for us, we have previously understand that we are understanding the importance of the scientific methodology. So these principles include the scientific methodology as a clue understanding, first of all. And then afterwards, all the social understanding occurs. The transdisciplinary view of these principles are crucial too, because it's complex knowledge. And it is crucial to bear mind on that. We are dealing with this principle through the understanding of the complex knowledge. And that's why I'm so happy to see people on the other side of the world that are thinking the same as we think and understanding the needs when we speak, that we deliver health. And health is not any other word. Health, it's a public order good. So responsibility has to focus on sharing data, but not sharing data as an issue of they are knowing something of my privacy. No, we are not asking about privacy. We are caring about citizens' privacy. We are much more than that. We are digital citizens in the understanding of our own anthropological dimension. If we do not share, we can also be exposed to maleficence because we won't be able to reach that beneficence. So it has sense in sense of autonomy, in sense of beneficence, and in sense of justice. So that's why I'm very proud of sharing these principles in my region. And when I say I say on behalf of the teamwork of this connection from Latin America, that now we are Recainsa. Recainsa do highly support. I don't know, Jocelyn, your opinion.
Yes, I am. Good morning. Well, thank you, Maria Isabel, for sharing your thoughts. And well, first of all, I just want to, on behalf of all of us at Recainsa, I would like to congratulate our sister network, AeHIN, for organizing this activity and above all, for leading that conversation in order to strengthen the governance of health data in your region and globally. And as you know, in Recainsa, we support the principles because we believe that this frame of a principle that, as Kirsten has shared before, were developed through a very participative process and were thought to universalize the data governance in the globe. And I just wanted to share that Recainsa is also trying to strengthen the principles, and that we are organizing a regional multi-stakeholder workshop. And we're going to have the participation of governments, regional authorities, cooperation agencies, NGOs, academia, professional associations, and private sector. So we would love to share after our workshop all the thoughts and all the visions and opinions that we're gonna gather together in this workshop in order to continue the conversation and to support the principles globally, and above all, to seek for opportunities surrounding the World Health Assembly as well. Thank you.
Thank you, Celine and Maria, for being with us and then also sharing the experiences from Recainsa. We are very happy to have you. We have about, we have 20 minutes for the questions. We can take some questions, and then the questions anyone can answer. So including the speaker as well as the reactors. Alvin, did I see your hand?
Yeah, so I'm a resource person, but I also wanted to ask a question whether there are plans to localize the principles, since we're targeting as many of the beneficiaries as possible, and these are the citizens. They might not be well versed in English, and they might need to have the principles translated into the local language. So I wanted to find out from Transform Health if there's any initiative to do that. Of course, we're willing to help, but we wanted it to be within the framework of Transform Health's organizing framework. Over.
Yeah, so we have all the principles and all the resources currently translated in 3 languages. So we have English, French, and Spanish. We don't necessarily have plans right now to translate into local languages, but we very much encourage it. So we want to see, and we'd be happy to work and speak to any organizations that would want to translate it into local languages, and how we could potentially support with that or work with you to do that. As I said before, when we launch the principles, we very much want them to be owned by the community as well. But we're happy to support with how we can do that as well, because we really want it to, not discuss later, kind of the importance of the global frameworks, national and subnational level, but we very much want to see it also reaching communities. So yeah, I think we'd be very supportive and happy to work with partners that would want to see it translated to local level, of how we can potentially support or engage around that, because we really want it to reach community level as well, and that's such an important aspect of that. So definitely supportive of that.
Thank you, Kirsten. The medical students here are very much engaged in translating. So I guess by letting them lead the translation, it hits 2 birds with 1 stone. They get to be able to communicate it to the people that they serve. Thank you.
Yeah, that's perfect.
Actually, I think Christine haven't answered my question. That when we see the endorsement organization, most of the NGO or academia or something like that. How about the countries? I don't know that how I'm talking about the politics, because I'm very surprised that one of the group say that, do we need the global framework for health data governance, something like that. I would like to know what is the resistance for people to adopt or endorse this kind of the principle, even it's only the principle which has the human right and universal health backing up. what is the political or what is the resistance to adopt this?
Yeah, I'm happy to try and address that. So I 100% agree that we need to see countries endorsing them. And there hasn't been, we haven't had resistance necessarily from countries, but more that I think it's just more of it's a longer process, obviously, to go through the process of that. So it's something we're definitely pushing for. So they were launched just over a month ago. Wide number of endorsements from different stakeholder groups, but including a large number from civil society organizations, for example. But we really want to see as that next step is countries really endorsing them. So really encourage, different stakeholders to help support that. It was really great to see some encouraging remarks from Malaysia around potentially endorsing and taking that forward. So I think it's more a kind of time and process question rather than a resistance to it. But we definitely see that as being a really key step. And yeah, I think one of the questions that's come up around, endorsement, the one resistance you could say, but more just a question is kind of the legal implications of it. And we're looking to strengthen a little bit our kind of framing around that because, they're principles. So they're normative guidance of what good data governance should look like rather than a legally binding document. So we are looking to kind of address and strengthen the language to make that very clear, but we do want to see the move towards that legally binding, because when we look at implementation, and accountability, there were questions around accountability around that, is when it gets down to then national legislation and national regulations, that's where you get the very kind of binding agreements that you can hold governments accountable to. So while we very much obviously want to see accountable around the principles, I think we then need to move towards those frameworks and national legislation to really be able to hold governments accountable to it. That said, where organizations and governments do endorse the principles, we want to hold them accountable for what they've signed up to and what they're committing to try and achieve through how they manage and use health data. So we really encourage all stakeholders within countries, if their governments or other organizations have endorsed the principles, hold them to account to what that means, and to really make sure that we are, standing by what organizations and governments have endorsed through them. We are looking to see, there have been questions about what can we do to help support that monitoring and in accountability. So we're very open to suggestions on that. For example, do we have some sort of reporting tool on the community page of the website where endorsing organizations can show, maybe a report card sort of system, how they are implementing following their endorsement. But this is something we want to look at. But for now, we really encourage different partners to hold those other organizations and governments accountable that have endorsed. I think maybe just one more comment around the question, do we need a global framework? I think there's a lot of support and understanding of why we do need a global framework. And I think why the global framework is what will be essential will be the national legislation, national implementation. But why we think the global framework is such a key step towards that is to have that global agreement and alignment of what good health data governance should look like, to then use, and then that should then guide national legislation and regulation. So while we see that as such an important point, and as COVID has showed us the importance of cross-border data sharing, et cetera. So it's not only important from the cross-country perspective, but also then, to help support and improve data policy and decisions at national level. So, this is why we think a global framework is so important for this, but then that needs to be then adapted and endorsed at national level to really have that binding agreements at national level. And if I can make one last comment about why wait till 2024? Loved this comment, fully agree. I think we put a 2024 deadline basically just in terms of process. So, we have the World Health Assembly coming up later this month. It's not on the official agenda of the World Health Assembly. We wish it were, because we think it's such a critical conversation to be had. But this is where we really need governments and other stakeholders advocating for governments to request it to be on the agenda. So any governments on the call or listening, we encourage you to ask for a special agenda item on health data governance and the need for a global framework at the World Health Assembly. But we need governments really championing that. So, Malaysia has already indicated support for that. It'd be great if Malaysia, as well as others, can really champion us through the WHA agenda to get that global framework sooner rather than later. But yeah, thank you. I really encourage and really appreciative of all of the kind of support and feedback and insights into this. Yeah, it's been really great feedback from all of you.
Thanks, Kristen. I do see at least 4 Ministry of Health officials here, so I'm sure that they would have heard you, and then hope to get the support from them to take the principles to practice in their own countries. And then if you need any support on that to organize a workshop, please do reach out to AeHIN as well as to Transform Health. Thank you very much. And then I think we can take one more question before we wrap up. We have about 7 minutes. Can we have one more question? Do we have a question? Or any one of the reactors would like to add additional points? That's also welcome if you don't have questions.
Jay, I wanted to ask what will happen at the World Health Assembly, given that the principles, we've spent some time coming up with the principles already, and what would be the activities to expect at the WHA? Over.
Yeah. So as I said, because it's not on the official program of the World Health Assembly, but we want to bring it up, kind of up the political agenda and make sure it is, raising as an important agenda item that needs to be pushed forward, hopefully for next year's World Health Assembly. But we are together with a number of our partners organizing a side event on health data governance, which will take place on the 25th of May. For those that will be in Geneva, please let me know. I'm not sure if maybe the best way if you reach out to AeHIN and they can connect you. We'd love to have you at the side event. Also, any government representatives that would like to speak during the side event and really to show your support on this, we'd love to have you as part of that as well. So we'll be organizing that to really try to bring together. So that will it will bring together different stakeholder voices, similar to this on, why stronger health data governance is so important, why we need the principles in a global framework, as well as government respondents on what they can do to help drive progress on this agenda. So it's happening on the 25th. So that's one of the key things that we're doing to try and, bring these discussions higher up on political agendas around the World Health Assembly. And then we also just really encourage, as I said, governments through their engagement during the official agendas to raise these issues and try to get an agenda item to start those discussions on, a global framework, and also for other stakeholders to encourage their governments to do that as well. So those are some of the things happening around the World Health Assembly. And if anyone else has any, suggestions of what more can be done, we very much welcome that.
Thank you, Kirsten.
Hello. I wonder, Christine, that there is at least 2 departments in the World WHO headquarters that deal with data, the digital health and innovation department, and also the Department of the Knowledge Sharing or something like that. We have several colleagues working in there. I don't quite, I don't see their names on the kind of the developing this kind of the principle. I wonder that do we approach them? Transform Health, approach these 2 departments, at least to us as the country, we get the normative from the WHO and from the ITU on the digital health. So those 2 UN organization that has the kind of the influential on the country about the normative principle like this. Over to you, Christine.
Yeah, so we've been engaging with WHO a lot throughout this process, and they have been involved in the various consultations, including the public consultation, to help feed into the principles. We would love to see WHO endorse the principles themselves as well. I know that's quite a long, complicated process, but it'd be great to see them backing the principles as well, which align to a lot of the work they're doing anyway. But also these principles are there's also obviously the WHO data principles that's, guidance for WHO, but these principles we see as kind of building on that, but are applicable across a wider audience. But yeah, we definitely engage with WHO on this agenda. Someone from WHO will be at the side event as well to make an intervention on the principles and health data governance. So yeah, definitely see, there's such a key player on this. And this is also why when we have our calls for a global framework, we very much see as we want, while we're asking this of WHO as well, they obviously have to respond to their member states. So this is why we're really encouraging member states to mandate WHO to develop that global framework, because they're best positioned to develop such a global framework. Need to make sure that's done in a very inclusive, participatory manner in the same way the principles were done. But yeah, we very much see that should come from them to then come back to member states as a resolution for adoption. But therefore, that's why we're pushing for governments and member states to mandate the WHO to do this. So to put the request to WHO to do it.
Thank you, Kristen. I think it's also time to wrap up. We just have about 3 minutes. And the timeline reminds me of something I read, I think just last week. This is from the European Commission, and then they released a draft on health data space, and then that talks about making the personal information of about 740 million citizens of 27 member states being available for the medical professionals, and then also the raw data being available with strict procedures in place for research and other purposes. So this is something that's also happening, and then their timeline is 2025. So any citizen, any European citizen within this 27 member states, they can sort of like their data can be accessible for medical professionals, especially when they are in across the border in any other countries within the bloc. And so they talk about both about research as well as data being accessible for care within the EU borders. So that's also, I think, important development. So 2025.
Hi, I think the Chai connection has been lost. So thank you, Christine, Transform Health, and all our colleagues and partners like the IPPF, our Lakansa, and Bhutan, Laos, Malaysia, Indonesia, and all our colleagues, and think to come and brainstorming and talking about this kind of the very important issue. We will work on the health data governance for sure in the next many years ahead. So Chai is now coming back. Chai, you lost, so I just to take your your role. You should close this kind of this webinar, please.
Thank you, Dr. Bunchai. Sorry, call just dropped unexpectedly. Sorry for that. Thanks everyone. And then I think we had a good variety of perspectives and rich feedback. I think we will all, this is just a beginning, because the principles were released, as Kristen said, just a month ago, a month and 2 days to the date. So we have a lot to go. And then I'm sure that we also have this Digital Health Week coming this October. I'm sure that before that we would have many more such interactions, and beginning also with the side meeting in Geneva around the World Health Assembly. So we do look forward to join. Please do get back to us with any other feedback, even some of them might have missed. I do see a lot of registrations, but some of them said that they could not attend due to conflicts. I'm sure that they will also reach out to us. And thank you, everyone. Thanks again. Thank you.
Thank you. Good night.
Thank you. Good night.
Thanks, everyone. Bye-bye.
Bye-bye.
Good night.